Hello everybody, my name is Dr. Eric Miller. I'm with Chiro-Med Health Wellness Centers in Orland Park, Illinois. Today's topic is about sciatica. Sciatica is a condition in which the patient presents with generally lower back pain and pain in the leg. Typically, the pain in the leg is produced by an actual pinch of the sciatic nerve. The sciatic nerve is the largest nerve in the entire body. It's made up of a few different levels coming from the spinal cord. Let me show you real quick. When we look at this particular diagram, you're going to see that the sciatic nerve is the largest nerve in the entire body. It basically is made up from the L4 vertebrae, L5, S1, S2. These nerves come together to create the large nerve. The nerve basically goes down through the thigh, all the way down the calf, and supplies the foot. Sciatica is basically diagnosed when that sciatic nerve becomes inflamed or pinched. The pain can be excruciating. Patients, when they come in with sciatica, can have difficulty walking, they can have cramping at night in their legs, they can have very severe pain that causes a muscular spasm as well. I'm going to show you a model of the actual nerve. I'm going to put this guy, Sammy the Spine, here. Sammy the Skeleton, on the table. Now, sciatic nerve, sciatica, is actually caused by pressure on the sciatic nerve. The pressure can come from inflammation, it can come from soft tissue irritation, from soft tissues being too tight, or hard tissue, which is bone. So typically the doctor needs to find out exactly where that sciatic nerve pressure is coming from. When the patient presents to the office, they're generally going to complain of lower back pain, they're going to complain of pain in the rear end, and most likely pain that comes down the thigh, and it will either come to the side of their calf, which is called the L5 distribution, or the back of their calf, which is the S1 distribution. The pain can even go down all the way to the top of the foot, which is the L5 distribution, or the bottom of the foot, which is again the S1 distribution. So it's the job of the physician to find out what particular nerve is being pinched, why it's being pinched, and what can be done to remove that pinch. I'm going to use this model to show you exactly what the sciatic nerve looks like and where it can be compromised or where it can be getting pinched at. When I look at this particular model, you can see the sciatic nerve kind of peeking out right here. Here's a picture of it, or a look at it without the muscular components that go from the iliac bone to the hip itself. When we look at the right-hand side, you can see some, not all, but some of the deeper muscles through the buttocks and the hip rotators. So the sciatic nerve basically comes from the spine, it traverses by the sacrum and sacroiliac joint, and then through the buttocks before it enters into the leg or the thigh. The most common places for it to be inflamed or irritated are again with the soft tissue, which can be muscular. There's a muscle in the rear end called the piriformis muscle that when it becomes tight, it can actually press on the sciatic nerve and produce a lot of symptoms that way. Sometimes the sciatic nerve even goes through the piriformis muscle. It just kind of depends on how you're put together. So that's one of the first places we look to make sure that it's not being irritated at the muscular level, is the piriformis. We also have to look at the gluteus medius, which is one of your buttocks muscles. You've got gluteus maximus, gluteus medius, and gluteus minimus. When you have sacroiliac dysfunction, you'll have a lot of tension through gluteus medius, and sometimes that will create enough tension to produce some irritation of that sciatic nerve. You can also get the hard tissue problems, misalignment of the joints. So when there's a sacroiliac problem a little higher up, then we can have problems with inflammation coming from the sacroiliac misalignment, creating pressure on that sciatic nerve, or misalignment from the L5, S1 or the L4, L5 vertebrae, creating inflammation of the joint that ends up putting pressure on the nerve roots that come out between the vertebrae and basically supply the sciatic nerve. Another place to look for possible irritation to the sciatic nerve is the hip rotators themselves. So you've got small muscles below the piriformis muscle that can also put pressure on the bottom side of that sciatic nerve. Typically when the sciatic nerve is affected, you're going to get hamstring tension, you're going to get tension in the rear end muscles, and then you could get tension in the calf muscles as well on the affected side. So it's real important to stretch those muscles to try to calm down that muscular component of the problem. Now, the way that we actually take care of the joint problem, the joints causing the inflammation, is to check out your alignment. So I'm going to show you an x-ray right here and kind of give you an idea of what a typical patient with sciatica would look like on x-ray. This is a patient that I had about 4 months ago. She came into the office and she was complaining of severe lower back pain. She was complaining of pain through the rear end, into the thigh, down to the calf, and it was localized more on the outside of the calf muscle. That represents a pinch at the L5 nerve. When we looked at her x-rays, we did a complete examination, we did x-rays, and we were looking for any type of bony impingement, either misalignment or any arthritic change or something that would be actually causing bony pressure to be placed on the nerve roots that make up the sciatic nerve. When we looked at this particular x-ray, we saw that there was a lot of spasm in the area, the vertebrae was being pulled out of alignment. The typical alignment would be that the pelvis is balanced from side to side and the spine is straight up and down along this blue line. You can see with this particular patient that she had rotation at L5, she had rotation and lateral bending at L4, and then L3 was really laterally bent to the side. There was a 12-degree misalignment, forcing all the vertebrae over to the side this way. Some of that came from just joint misalignment. Some of it came from inflammatory response and muscular spasm as a result of that. But the whole thing is basically misaligned, and that's creating that pressure on the sciatic nerve that causes those symptoms. There's only a few different ways to take care of sciatica. You know, if you go to the traditional medical doc, family practitioner, you're going to get painkillers to help mask the pain, anti-inflammatory to help to handle the inflammatory part of that, and then muscle relaxers to help relax the spasm if there's any spasm occurring. Unfortunately, that doesn't really fix the problem. When you have a mechanical source of sciatica, such as misalignment or arthritic changes, then there's really no way to get rid of that without moving the structural component. There are a couple other conditions that we have to rule out whenever we're trying to diagnose what the actual cause of sciatica is. Most people come in complaining of leg pain, so you've got to make sure that there's not a problem with vascularity. It could be varicosity causing leg pain, it could be a blood clot in the calf causing pain or behind the knee. You've got to make sure that you're accurately diagnosed, that you get x-rays, that you have a complete examination to make sure that you're not overlooking a more problematic situation. So we got to make sure that the venous system and the arterial system are doing what they're supposed to be doing, and there's no issues with that, and then tackle the muscular part of it, the joint part of it, and again the hard tissue part of it, making sure that the bones aren't completely degenerated and don't need surgery. The most important thing if you're having leg pain is to get a proper diagnosis. Is it really sciatica? Is it, a blood clot? You need to see a physician for that. So make sure that you get to a physician that knows musculoskeletal and nerve-related conditions, like a chiropractic physician or a physiatrist or an orthopedic neurologist, somebody that deals with that regularly. The sciatica needs to be completely diagnose what's actually causing it. Is it muscular? Is it just inflammation from joint? Is it hard tissue like bone that's putting pressure on it, and can it be removed? Can we take the stress off the nerve so the nerve can function like it should and eliminate the symptoms like the burning, cramping, numbness, tingling, pain in the leg that comes along with sciatica? I hope this information's really helpful for you. If you have sciatica, feel free to contact us anytime. Our phone number is 708-403-2727. Take care.